Thanks, the mic's on, I can tell. Thank everybody for coming. I appreciate you all being here. You may have just heard me say how much we appreciate the fact that the public is exhibiting an incredible interest in this. We, many of you are maybe not familiar with the Blue Dogs, but the conservative Blue Dogs were able to prevent the Waxman bill from coming to the floor for a vote. It's a poorly formed bill. It's a bill that, had it come to the floor for a vote, would have been defeated. Nancy Pelosi was trying to force the vote like cap and trade was forced. Waxman was forcing the vote, and 52 of us who are conservative members of Congress prevented that from occurring. Right now, the Senate does not have a bill. It will not have a bill until September. In the House, the Waxman bill is out of committee but was not allowed to come to the floor. There will be no health care legislation voted on until probably October, November of this year. We do not think, and I will not be in favor of any health care bill that has a federal insurance program in it. The public option is unnecessary if we reform the private health insurance industry. Private health insurance companies for a long time have enjoyed a monopolistic approach to states. We want them to compete across state lines. We do not want them to be able to disallow coverage for a pre-existing illness. We do not want them to be able to overrate someone for age. And we want small independent businesses with similar backgrounds to be able to join together and approach different private health insurance companies for bids on their health care. We want individuals, we want small businesses to be able to go to the marketplace for their health insurance just like they do for their homeowners, for their car insurance, and for their health insurance. The Waxman bill is a poorly thought out bill. It's overreaching. It has components, or it has parts of it that are absolutely unacceptable to most Americans. So these have been questions that I've been asked about over the district. I'm sure that some of you may have other questions, but fundamentally, the health insurance industry needs to be reformed. Secondly, you cannot reform any industry around a scarcity. And the scarcity in this particular case are MDs. There's an acute shortage of physicians. You cannot reform any industry around a scarcity. We need a medical school in North Alabama. We need residency programs at this hospital and at the Huntsville Hospital. We need to train primary care physicians to take care of our citizens. 35% of the physicians in America today are trained outside of the United States, and that should be ashamed, and we should be embarrassed by that. We have men and women, young men and women in our colleges today who have great grade point averages, do well on MCAT scores, and are turned down because we don't have places for them in our medical schools. That should not exist. We have an acute shortage of primary care doctors. Less than 2% of our physicians go into primary care. 25% of our physicians who deliver primary care are 55 years of age and over and are moving off into retirement. We have a huge baby boom generation coming through, and we need someone to take care of them, and we've dropped the ball on that. True reform will increase the number of primary care physicians. True reform will require private insurance companies to compete against one another for your business. Those are the things that need to be in the bill. Comparative effectiveness is fine as a theory. It cannot be incorporated into the body of a bill or made into a reason to disallow care for any American. If we had comparative effectiveness in legislation today, many of us would not be here. There are many countries that have comparative effectiveness in their legislation. They do not treat lung cancer. They don't treat childhood leukemia. They don't treat lymphoma. They don't treat non-Hodgkin's lymphoma. They don't treat stage 2 ovarian. And we do not want any part of that in our legislation that would come out of Congress. So I know that I haven't covered everything, but I would be happy to answer any questions. Yes, sir.
Thank you, sir. I appreciate your taking your time and your interest to allow us to speak to you. You said that we were interested in our health care issues. I'd like to correct that word, sir. We're insulted by the things that our government is trying to place upon us, and it seems endless that the kind of things that are coming down are so socialistic that we are opposed to that form of ideology in government. And this thing is absolutely scary. And we were hoping that you could see through that maze and give us some hope that we can have a government where the institutions serve the people rather than the people attempting to serve the institutions.
I couldn't have said it better myself. Thank you. I completely agree with you. And that's one of the reasons.
Vote in accordance with that sort of dictate, sir.
Well, let's see. I voted against the stimulus. I voted against cap and trade. I voted against the bailout of the banks. Every major bill that has come before us that expanded government, I voted against it. I have voted, and you knew a month ago that I was against the Waxman health care bill, and I have been against it, and we were able to keep this from coming to the floor. The Waxman bill will not exist in its present form. We're more likely to get a bill out of the Senate than we will out of the House. The Senate is working in a bipartisan way. The other thing about the partisanship that's going on in our Congress right now is that if a health care bill comes to fruition and it is partisan, Obama will be a one-term president, the majority in the House will be reversed, and the next administration will reverse that legislation. Now, that being said, everybody in the House and everyone in the Senate wants to improve our health care system. It's not that we don't want to improve it, it's that we don't want the government to control it. A federal insurance program is a Trojan horse. The methodology is simple. If you see it and you look at it, it'll have the unintended consequence of we'll have Medicaid, Medicare, a federal insurance program, and the VA system, and S-chip will be your options for health care. That is unacceptable to America.
Unacceptable, sir. Unacceptable.
Thank you. You and I are on the same page. Yes, sir.
Dr. Griffith, glad to have you to represent us physicians in the... You know, your plate is full. You don't need something else to deal with and to mess up. So leave health care alone for now.
Hear, hear!
Well, I think the doctor's making a very good point. 85% of our healthcare system is excellent. What we want to do is improve access. The 47 million Americans that they talk about that don't have health care, 9 million of those are under 10 years of age. Another 25 million are under 40. But we do have that group of individuals that we want to help that are between jobs, their employer cancels their health insurance, they're laid off, their businesses go bankrupt, they're small businesses that want to provide health care for their employees, but it's too expensive for them. Those are the kind of solutions. We don't need to change the system. The system is good. Deaths from cardiovascular disease are going this way. Deaths, morbidity from cardiovascular disease are going this way. If you take out deaths from cancer, if you take out smoking-related cancer deaths, deaths from cancer in the United States are going down. Our fastest growing population is 80 plus and over. Our system is doing something right. We do not need to throw the baby out with the bathwater. That's why we're standing in the door as far as this is concerned on health care.